Monoamine Oxidase Inhibitors, or MAOIs, are a class of medications that consist of three subtypes: Irreversible Non-selective MAOIs, Reversible Inhibitors of MAO-A, and Selective MAO-B Inhibitors. While these subtypes share many similarities, they also have distinct differences. If you want to learn more about any of these three subtypes, you can click the link on screen or in the description below. MAOIs work by inhibiting the action of monoamine oxidase, an enzyme found in presynaptic nerve terminals within the central and peripheral nervous systems. There are two primary types of monoamine oxidase, MAO-A and MAO-B. These enzymes play a crucial role in activating reabsorbed monoamine neurotransmitters. Specifically, MAO-A inactivates serotonin, norepinephrine, and dopamine, while MAO-B primarily inactivates dopamine. When MAOIs bind to MAO-A and MAO-B, they inhibit these enzymes' activity, thereby reducing the inactivation of serotonin, norepinephrine, and dopamine. These neurotransmitters, when reabsorbed, then accumulate in synaptic vesicles within the presynaptic neuron. When the neuron is next stimulated, these neurotransmitters are released into the synaptic cleft, or the space between neighboring neurons, or a neuron and its target tissue. As a result, the effects of the neurotransmitters on their target neuron or tissue are increased. In the peripheral nervous system, MAOIs primarily increase the release of norepinephrine. This norepinephrine acts on the adrenergic system, binding to alpha and beta adrenergic receptors. As a result of this action, MAOIs can be classified as indirect adrenergic agonists. However, MAOIs are not used for their effects on the peripheral nervous system. Instead, MAOIs are used for their effects on the central nervous system. Increased serotonin, norepinephrine, and dopamine levels in the central nervous system improve mood and enhance alertness, focus, and motivation. Irreversible non-selective MAOIs and reversible inhibitors of MAO-A are mainly used to treat certain depressive disorders. However, they are not considered a first-line treatment due to their significant interactions with food and other medications. Whereas selective MAO-B inhibitors are mainly used to treat Parkinson's disease. Adverse effects of MAOIs include orthostatic hypotension, but also hypertensive episodes, xerostomia or dry mouth, insomnia, headaches, nausea, and diarrhea or constipation. MAOIs are contraindicated with pheochromocytoma, an adrenal gland tumor that can cause dangerously high blood pressure. Monitoring with an MAOI includes measuring blood pressure, pulse, and orthostatic vitals. Measuring orthostatic vitals involves measuring blood pressure and pulse, first while lying down, and then again after standing for 1 to 2 minutes. If orthostatic hypotension is a concern, changing position slowly can minimize it. It is also important to assess mental status if prescribed for depression, including mood, anxiety, and suicidal tendencies, especially in early therapy. Suicidal thoughts may intensify initially due to changes in neurotransmitter levels before the medication's full effects. Whereas if prescribed for Parkinson's disease, improvements in motor symptoms such as tremors, muscle weakness, and rigidity, and ataxic gait should be monitored. If insomnia is a problem, taking this medication in the morning may help. Whereas if nausea is a concern, taking it with food may help. It is also generally recommended to pause this medication for a period of time before undergoing general anesthesia whenever possible. MAOIs have serious drug-to-food interactions. These interactions occur due to the presence of MAO-A enzymes in the liver and intestinal wall, which are responsible for breaking down tyramine, an amino acid found in various foods. When MAOIs inhibit MAO-A, it cannot inactivate tyramine, leading to increased levels in the body. This is a concern because tyramine can trigger the release of norepinephrine, which may result in a hypertensive crisis, and a hypertensive crisis can result in stroke or even death. Therefore, individuals taking MAOIs are either required to completely avoid or severely limit their intake of tyramine-rich foods, depending on the specific type of MAOI they are on. Tyramine-rich foods include aged cheese, cured smoked or processed meats, such as ham, fermented or pickled products, such as soy sauce and pickled cucumbers, some alcoholic beverages, such as red wine and beer, yeast extracts such as Vegemite, and dried, citrus, tropical, or overripe fruit. MAOIs have many drug interactions. Therefore, it is crucial to consult a healthcare professional before taking any medications, including prescription drugs, over-the-counter products, and herbal supplements. MAOIs should not be used with other antidepressants, such as selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors, and some atypical antidepressants. Doing so can lead to a hypertensive crisis, and in cases involving serotonergic antidepressants, it can lead to serotonin syndrome. Additionally, they should not be used with sympathomimetic drugs, such as amphetamines, a central nervous system stimulant, norepinephrine, a vasopressor, and pseudoephedrine, a nasal decongestant, as this too can lead to a hypertensive crisis. I hope you found this video helpful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!